SARS-CoV-2, also known as COVID-19, is a novel coronavirus that was first identified in Wuhan, China in December 2019. Coronaviruses are a family of viruses that can cause respiratory illness in humans and animals. SARS-CoV-2 is a highly infectious virus that is primarily spread through respiratory droplets when an infected person talks, coughs, or sneezes. The virus has a unique structure that allows it to infect human cells. It has a spike protein on its surface that binds to a receptor called ACE2 on human cells. Once the virus enters human cells, it uses the cell's machinery to replicate itself and spread throughout the body. COVID-19 symptoms can range from mild to severe and include fever, cough, and difficulty breathing. The virus can be particularly dangerous for older adults and people with underlying health conditions. To prevent the spread of COVID-19, public health officials recommend practicing good hygiene, such as washing hands frequently and wearing a mask in public. Social distancing measures, such as staying at least 6 feet away from others, can also help prevent the spread of the virus. As of August 2021, there have been over 200 million confirmed cases of COVID-19 worldwide and over 4 million deaths. Vaccines have been developed and authorized for emergency use to prevent COVID-19, and efforts to distribute and administer vaccines are ongoing. SARS-CoV-2, also known as COVID-19, is a highly infectious respiratory illness caused by the novel coronavirus. The virus is believed to have originated in bats and was transmitted to humans through an intermediate host, possibly a pangolin. The exact origin of the virus is still being investigated, but it is thought to have emerged in a seafood market in Wuhan, China in late 2019. The virus spreads through respiratory droplets when an infected person talks, coughs, or sneezes. It can also spread by touching a surface contaminated with the virus and then touching one's face. The virus can survive on surfaces for several hours or even days, depending on the type of surface. Once the virus enters the body, it attaches to ACE2 receptors on the surface of cells in the respiratory tract, allowing it to enter and infect the cells. The virus then replicates and spreads to other cells, causing inflammation and damage to the respiratory system. This can lead to symptoms such as cough, fever, and shortness of breath. Some people are at higher risk of developing severe illness from COVID-19, including older adults and those with underlying health conditions such as diabetes, heart disease, and lung disease. The virus can also cause severe illness in children and young adults, although this is less common. There is currently no specific treatment for COVID-19, but supportive care can help manage symptoms and prevent complications. Prevention measures such as wearing masks, social distancing, and frequent hand washing can help reduce the spread of the virus. In conclusion, SARS-CoV-2 is a highly infectious respiratory illness caused by the novel coronavirus. The virus spreads through respiratory droplets and can survive on surfaces for several hours or days. Once inside the body, the virus attaches to ACE2 receptors and causes inflammation and damage to the respiratory system. Prevention measures such as wearing masks and social distancing can help reduce the spread of the virus. 1. Citrus fruits. Citrus fruits such as oranges, lemons, and grapefruits are rich in vitamin C, which is known to boost the immune system. Vitamin C helps to increase the production of white blood cells, which are essential for fighting off infections. antioxidants, which help to protect the body from free radicals that can damage cells. They are also a good source of vitamin C, which, as mentioned earlier, is essential for a healthy immune system. 3. Garlic. Garlic has been used for centuries for its medicinal properties. It contains a compound called allicin, which has been shown to have antimicrobial and antiviral properties. It is also believed to help boost the immune system. 4. Ginger. Ginger is another food that has been used for its medicinal properties for centuries. It contains compounds called gingerols and shogols, which have been shown to have anti-inflammatory and antioxidant properties. It is also believed to help boost the immune system. 5. Yogurt. Yogurt is rich in probiotics, which are beneficial bacteria that live in the gut. These bacteria help to keep the gut healthy, which in turn helps to boost the immune system. Yogurt is also a good source of vitamin D, which is essential for a healthy immune system. 1. Processed foods. Processed foods contain high amounts of sugar, salt, and unhealthy fats that can weaken the immune system, making it more susceptible to infections like COVID-19. They also lack essential nutrients that are crucial for maintaining a healthy immune system. 2. Sugary drinks. Sugary drinks like soda, sports drinks, and fruit juices contain high amounts of sugar that can lead to inflammation and weaken the immune system. They also lack essential nutrients like vitamins and minerals that are important for maintaining a healthy immune system. 3. Fried foods. Fried foods like French fries, fried chicken, and fried fish contain high amounts of unhealthy fats that can increase inflammation in the body and weaken the immune system. They also lack essential nutrients that are important for maintaining a healthy immune system. 4. Alcohol. Alcohol can weaken the immune system by reducing the number of white blood cells that are crucial for fighting infections like COVID-19. It can also lead to dehydration, which can make it harder for the body to fight off infections. 5. Processed meats. Processed meats like hot dogs, sausages, and bacon contain high amounts of saturated fats and sodium that can increase inflammation in the body and weaken the immune system. They also lack essential nutrients like vitamins and minerals that are important for maintaining a healthy immune system. SARS-CoV-2, commonly known as COVID-19, is a highly contagious virus that has spread rapidly throughout the world. The virus is primarily spread through respiratory droplets when an infected person coughs, sneezes, or talks. To prevent getting infected with the virus, it is important to take preventive measures. Firstly, it is important to practice good personal hygiene. This includes washing your hands frequently with soap and water for at least 20 seconds, or using an alcohol-based hand sanitizer when soap and water are not available. It is also important to avoid touching your face, especially your eyes, nose, and mouth, as this is how the virus can enter your body. Secondly, it is important to practice social distancing. This means staying at least 6 feet away from other people, especially those who are sick. avoid large gatherings in crowded places, and if you must be in public, wear a face mask to reduce the spread of respiratory droplets. Thirdly, it is important to keep your surroundings clean and disinfected. Frequently touched surfaces such as doorknobs, light switches, and countertops should be cleaned and disinfected regularly. Fourthly, it is important to monitor your health and seek medical attention if you experience any symptoms of COVID-19. Symptoms include fever, cough, shortness of breath, fatigue, body aches, and loss of taste or smell. Lastly, it is important to stay informed and follow guidelines from health authorities. As the situation with COVID-19 is constantly evolving, it is important to stay up to date with the latest information and guidelines to protect yourself and those around you. In summary, to prevent getting infected with SARS-CoV-2, it is important to practice good personal hygiene, practice social distancing, keep your surroundings clean and disinfected, monitor your health, and stay informed. SARS-CoV-2, commonly known as COVID-19, is a highly infectious respiratory illness that has affected millions of people worldwide. While there is currently no known cure for the virus, there are several ways to manage and treat the symptoms of COVID-19. Here are some of the ways to cure SARS-CoV-2. 1. Supportive care. This involves managing the symptoms of COVID-19, such as fever, cough, and shortness of breath. This can be done through rest, hydration, and over-the-counter medications such as acetaminophen. 2. Oxygen therapy. For patients with severe COVID-19 symptoms, oxygen therapy can be used to help them breathe easier. This can be done through a nasal cannula or a mask. 3. Antiviral medication. There are several antiviral medications that are being used to treat COVID-19, such as remdesivir and favipiravir. These medications work by inhibiting the replication of the virus in the body. 4. Steroids. In some cases, steroids such as dexamethasone may be used to reduce inflammation in the lungs caused by COVID-19. 5. Convalescent plasma therapy. This involves using plasma from people who have recovered from COVID-19 to treat those who are currently infected. The plasma contains antibodies that can help fight the virus. 6. Vaccines. Vaccines are being developed and distributed worldwide to prevent the spread of COVID-19. These vaccines work by teaching the body's immune system to recognize and fight the virus. It is important to note that while these treatments can help manage the symptoms of COVID-19, the best way to prevent the spread of the virus is through practicing good hygiene and social distancing. If you are experiencing symptoms of COVID-19, it is important to seek medical attention immediately. I hope you found this information helpful. Please consider subscribing and setting notifications for future updates.